While we have recently seen reductions in cases and deaths, we must remain cautious. The average daily death rate is tragically still more than twice that seen last September. We are in a race to stop transmission, and the emergence of variants that spread more easily has made that even more challenging. I am committed to closely monitoring the proliferation of these variants in our country and around the world. CDC is working in coordination with national, state, tribal, and local governmental and non-governmental partners to build trust in the vaccines, the vaccinators, and the vaccination system. Instrumental to this work is addressing barriers to vaccinations in communities of color and disproportionately affected groups. COVID-19 has highlighted long-standing systemic health disparities, and health equity must be a cornerstone of our public health work. Now, you raise a really important point, and that is this 6 feet versus 3 foot question. As soon as our guidance came out, it became very clear that 6 feet was among the things that was keeping schools closed. And in that context, science evolves. So there has been one study that was published late last week that demonstrated in Massachusetts, where there's generally 100% mask wearing, that 3 feet was actually safe. Student rates and teacher rates of disease were the same in 6 feet versus 3 feet.
We must deal with viral variants, which are mutational changes in the virus, which have been a source of discomfort and concern among many nations throughout the world. We will address them by enhancing our vaccination programs against the wild-type virus, by boosting with variant-specific viruses, and, as we mentioned over and over again, by implementing the public health measures of masks, distancing, avoiding congregate settings, and washing of hands. For high school students, it looks like they will be available to get vaccinated in the beginning of the fall, very likely for the fall term. With regard to children, we're doing an age de-escalation study in elementary school children from 12 to 9, 9 to 6, 6 to 2, and 6 months to 2 years. We anticipate we'll have enough data to be able to vaccinate these younger children by the first quarter of 2022. My concern is that we prematurely pull back and don't give the vaccines time to continue to protect the country. With regard to the future, and your question that you asked, my concern is that we don't have the corporate memory of lessons learned, and we don't look at what happened to us here and the things that we need to do in the future to prevent this from happening again.